All right, everybody, welcome back. We are jumping right into a deep dive today on something pretty concerning that's going on overseas,
Yeah.
over in China. And this is a kind of a medical mystery, I guess you could say. We're
Yeah.
seeing all these reports of this huge surge of HMPV cases.
Yeah.
Like just tons of people are getting sick and hospitals are absolutely overflowing. But here's the thing. The Chinese government isn't calling it a state of emergency.
Yeah. It is very interesting. It seems like a very serious situation on the ground, but so far, no official declaration.
Exactly. So that's what we are going to try to unpack today. We've got a bunch of sources lined up, some reports from the WHO, news articles from the region, even some scientific papers. Like we're going deep trying to figure out what's really going on.
Yeah, we're going to sort through all of it.
For sure. And I think before we even get into any of the details, we should probably start with like the basics. What exactly is HMPV?
Yeah, that's a great place to start. I mean, it's not exactly a household name, is it?
Not at all.
Okay, so HMPV stands for Human Metapneumovirus. And it's a respiratory virus, kind of in the same family as the common cold or the flu. So most people who get it, they have pretty mild symptoms. They might have a cough, a runny nose, maybe a little bit of a fever.
Okay.
And they usually just get better on their own without any problems.
Okay, so like if I had this, I might not even know it.
Exactly. You might just think you have a cold, right? Especially since there isn't really a specific test that like your doctor would routinely run for HMPV unless they were really suspecting it.
Interesting. All right, so that makes sense. But then what's going on in China? What's making this outbreak so different and so serious?
Yeah. So from the reports we have, it sounds like the sheer number of people getting sick is way higher than what they would normally see.
Right, and it's not just a few sniffles. I was reading some news reports, and they were describing, like, hospitals being completely overwhelmed,
Oh, yeah.
especially the children's hospitals.
Hmm.
I mean, imagine taking your kid to the hospital, and the waiting room is just packed, like wall-to-wall people. There are even these videos, and we don't know if they're totally legit or not, but they seem to show these hospital rooms so crowded that people are, like, practically on top of each other. It's kind of giving some people flashbacks to the early days of, you know,
The pandemic.
yeah, exactly.
Yeah.
So I'm looking at this and I'm thinking, okay, this is a big deal. But then the Chinese CDC is basically saying, oh, this is just a normal flu season, like nothing to see here. And they're pointing to these stats that supposedly 30% of the respiratory illness tests are coming back positive for influenza.
Yeah, and that is a pretty significant number,
Well, it is.
So it does suggest that influenza is playing a role in what's happening over there.
Right, but it's still strange that they aren't like officially declaring this a state of emergency. It's almost like they are trying to downplay it.
Yeah. I mean, declaring a state of emergency, that's a pretty big deal. It's not something that governments do lightly. They only usually do it when there's like a natural disaster or maybe some kind of major threat to public safety, something that they really need to have extra powers to control.
Makes you wonder, like, what are they thinking?
Yeah, there are definitely a few possible explanations. Maybe they're trying to avoid causing panic among the public, or maybe they're concerned about how it would look to the rest of the world if they admitted that things were this bad. It could damage their image.
Yeah, that makes sense, especially after, everything that happened with COVID. It's interesting, though, because this is a global health issue. And speaking of global health, what about the WHO? I mean, they haven't really said anything about this whole HMPV surge either. That seems odd, right?
Yeah, it is a little unusual for them to be so quiet on something like this.
Right, because usually they're like the ones raising the alarm,
You're right.
getting everybody's attention on these big outbreaks.
Yeah, I mean, you're right. Their role is to keep tabs on global health threats and to coordinate a response from the international community.
Yeah.
So it does make you wonder why they're not more vocal about this. Maybe they just don't have enough information from China yet to make a statement. Or maybe they're hesitant to step on China's toes, to get involved in something that China might consider to be an internal matter.
So like a diplomatic dance.
Yeah,
Yeah.
exactly. But it does raise some questions about how effective our global health systems really are, at detecting and responding to outbreaks before they get out of control. I mean, what happens if this spreads?
Well, that's what I was thinking, because it's not just contained to China. We've got reports that it's already spreading to some neighboring countries,
Oh, yeah.
especially Malaysia. Their cases are up by something like 45% compared to last year.
Wow.
So that's like 327 cases so far in 2024, just in Malaysia.
Yeah.
Do you think there's something that makes them more vulnerable?
That's hard to say for sure. Every country's got its own vulnerabilities, right? It depends on things like how old is their population, what's their healthcare system like, even their cultural practices can play a role. So it's tough to pinpoint exactly what's making Malaysia more susceptible,
Hmm.
but it does show how interconnected global health really is. What happens in one place doesn't stay there, you know? It can have a ripple effect across borders.
Yeah, for sure. So this all sounds kind of scary, to be honest. Should we be worried? Like, what can we do to protect ourselves?
I know it can sound alarming when you hear about a new virus spreading, but I think the most important thing is not to panic. Panicking never helps.
Right.
And the good news is that a lot of the stuff we've all learned to do over the past few years to protect ourselves from COVID, that stuff works for HMPV too. So think back to all those good habits you
You
developed.
mean like washing our hands a lot?
Exactly.
Yeah.
Hand washing, wearing a mask if you are in a crowded place, staying home if you are feeling sick, those are your best bets. It sounds simple, but it really does make a difference. And it's not just about protecting yourself from HMPV. It helps prevent the spread of all kinds of respiratory viruses. So it's good for everyone.
All right, so let's recap. We've got this pretty unusual HMPV outbreak happening in China. Hospitals are overwhelmed. But the government is not declaring a state of emergency. The WHO is being oddly silent about the whole thing. And meanwhile, it's starting to spread beyond China's borders.
Yep, that about sums it up.
So where does that leave us? What do we do with all of this information?
That's the million-dollar question, isn't it? I think the situation really highlights just how interconnected we all are when it comes to global health. In today's world, a virus can travel from one country to another incredibly fast.
Yeah.
So it makes you think, how can we as a global community do a better job of preparing for these kinds of outbreaks? How can we make sure we're responding quickly and effectively? And how do we balance the need for international cooperation with respecting each country's right to manage its own affairs? I don't know the answers to all those questions, but I think they're important ones to think about, especially as we move forward.
Yeah, absolutely. Lots to ponder. Well, we are going to continue following this story as it develops and keep you all updated. In the meantime, everybody stay safe out there. Stay curious, stay informed, and most importantly, stay healthy.